WHO and then the Federal Ministry of Health, Abia State has been able to buy into the WHO standard of 1 PHC per political ward. And you know, Abia State has 292 political wards. And so we've been able to redesignate 292 ward healthcare centers from that over 780. Okay. And then, of course, clearly, I know the next question is, what are you going to do with the remaining? And clearly, the direction is to redesignate the remaining as either healthcare posts or either healthcare clinics. And you know, these two later ones, their manpower needs are very, very minimal.
Okay.
And then,
go ahead.
Right.
Please.
And then we have also been very, very lucky. I'm sure that will come up as we go along. So this Abia State has bought into that, and we have designated. So we now have 292 primary healthcare centers representing political wards, one political ward and one primary healthcare center.
Functional, well equipped?
Well, we are now in that process.
Okay.
So maybe along the way, I'll tell you exactly why we are saying that we are on the way to now getting it in a working condition, because Abia State is one of the beneficiaries of the pilot status for the Basic Healthcare Provision Fund, and these funds are going to be deployed primarily and specifically for these primary healthcare centers.
Okay, Honorable Commissioner, can you highlight what your ministry has been able to achieve in the course of this? It's going to get to 4 years on May 29. Can you list them? Probably, if we journalists to question you, what have you been able to achieve in the Ministry of Health, right from the onset of this administration?
Okay, if you leave me, I'll give you the narrative.
Please do.
Okay. Obviously, yes, when we came on board, there was a mandate which I've just reeled out to you, being able to give affordable, available, and accessible health care, and where necessary, cutting-edge technology. Now, we've been able to, clearly walk in that direction, despite, a few challenges that we did have. Clearly, one, we've been able to apply a lot of prudence in the a lot of prudence in the resources that have been available, made available to us. We've also been able to change the mindset of people that we work with. Clearly, the civil servants I'm talking about here, we've been able to change their mindset that monies that come for development are not monies to be pocketed. We've also been able to have reach. The governor has a lot of reach, and he's also hired somebody who also has got a reach, and so that combination has actually played out positively for us. The other thing we've also been able to build on is confidence, because when I came on board, the confidence level for both the users of the health facilities was all waned out, and then the confidence of the people, funding partners who have supported us, were all gone. I will always tell people this. When I went for screening at the House of Assembly, the first question I was asked is, why do you think the development partners are running away, and what are you going to do differently? And my answer was very simple. If two of us have an arrangement and then you are keeping yours and I'm not keeping mine, at the expiration of that arrangement, you definitely will not want us to continue. And so clearly what we need to do is to build up that confidence again and say, if we both agree to do something, we will do so. And so confidence building has been a good aspect of what we've been doing so far in Abia State with our development partners. And of course, we've also imbibed this spirit of the public-private partnership, because that's the way to go in this modern age, that government does not have all the funds. And then, of course, with all these things in place, we've been able to impact on all the levels of healthcare, primary, secondary, and tertiary, but more importantly on the primary, because we know that that is where the bulk of our people, especially those in the rural areas, that is where they go to access health care. And so quite a good number of the projects that we have done have actually been targeted to them. Specifics. Okay. Right.
Okay.
I'm interested.
Yes.
Right. So specifics. We've been able to, using the power of our reach and our confidence, attracted people who have now come to help us. Okay. Of course, one of the biggest things that is going to happen to the healthcare industry in Abia State is what's going to happen next week. On Friday next week, the Honorable Minister of Health will formally come into Abia State to formally flag off the Basic Healthcare Provision Fund. We're talking of funds in excess of 2 billion. and it's going to be applied specifically for these 292 primary health care
Abia State
centers.
is expecting $2 billion.
I'm saying about
$2 billion.
yes, yes.
For
It's only when we
health
see.
sector in Abia
It's
State.
only when
Okay.
we see that we can
Okay.
then be specific. But
All
I
right.
know it's about that.
Okay, go ahead, please.
I think that has been approved from the Federal Executive Council.
Yeah.
Well, tell us, how did Abia qualify for that pilot project?
Well, I tell you something. I remember when I was coming back to Nigeria to serve, my friend had told me, say, when you go there, I know you'll be bubbling with ideas, but do not be discouraged because approval is not the same thing as release. And clearly, when I came and then saw the way things were panning out, I felt that maybe I was going to be lazy, because the governor does the due diligence of approving things for you, and then you now have the responsibility of chasing it, and then when you chase it down and get the release, then the next thing is the access to the funds to be able to do these things. And so with that difficulty at the back of my mind, I had to wear my thinking cap. And that's the reason why in Abia, in the State Ministry of Health today, you talk about thinking outside the box. And thinking outside the box is actually what has led to all the things you are going to ask me to list out for you at some point. It was thinking outside the box that led us to go into the National Council on Health in Sokoto, and when it was time to ask who next is going to host this thing, Abia State raised its hand and said, yes, we're going to host it. And besides, that was the first time in the southeast of Nigeria that the National Council had come. And that was because
2017.
Yes, 2007. And that was because some of us knew the benefits that were going to come. We were going to drag the whole... Okay, fine. So clearly that was the Basic Healthcare Provision Fund is the biggest thing that is going to happen in the state, like I said. Now, the funds that are going to come, there are 3 gateways for that fund. One will be for the Primary Healthcare Development Agency. The second one is the health insurance bit of it, and the third one is the emergency medical service. Do not forget, one of the first things that we did when we came on board was to put in the Abia emergency medical services, which everybody can see doing its duties. So clearly, the fund for the insurance, which is about 50% of that fund, is going to ensure that people go to our primary health care centers free of charge.
Okay.
Provided you are registered. And I'm saying it on good authority, and then for everybody to listen. You will go to our primary health care centers, the drugs will be available, and the service is free of charge.
So these are things to look out for
Yes.
in the second administration of Governor
Exactly. Exactly. And then the funds for the primary health care development agency will be to, one, improve on the personnel. Like most of them actually were not manned before now. Part of that fund is going to go into buying equipment. Part of that fund is going to buy the drugs that are going to be used. And part of that fund is going to be used in, we're not going to build brand new primary health care centers, but in those that are in states of dilapidation, part of that fund will be used in doing them up. And do not forget, before I leave this aspect, that one of the funding agencies that we've also attracted in this administration, the HP Plus, which is acting on behalf of the Bill and Melinda Gates, they've been able to, start a renovation works on some of the primary healthcare centers. I'm sure if you were listening to the radio 2 weeks ago, we were whizzing through the state, commissioning 6 of the facilities that they have made over in 72 hours. And when we say 72 hours, at the close of work on Friday, the workers left there, and by Monday morning when they came, that magic transformation had happened. And we were very busy commissioning. And this is 6 out of the total of 36 that Bill and Melinda Gates is doing for Abia State, and it's all spread across the state. Okay. Now, I had talked about the emergency medical services, which was one of the first projects that we did in 2016. Now, that service, I don't know if you are aware how it rolls. Clearly, it is supposed to be a caller service.
Okay.
You need to call them. There is a dedicated line.
That dial a doctor.
Yeah, no,
initiative?
it's not dial a doctor.
Okay, it's different now.
Yes, it's different.
Okay.
Yes, it's you need to dial into that service, into a call center that's actually here in Abia State. And when you make that call, you get triaged. In the triage, you are asked, a few questions, and then,
Quite commendable. But then it has come under serious scrutiny. So now we have you here. You're going to tell us again how that thing works. Yes, I call it that thing. How it works. And then tell us the level of subscription. Or was it just another white elephant project?
Well, clearly, they say a society that is ignorant, then it's not quite a good thing. I think this particular innovation that is actually, being done in other parts of the world, Abia State took the bull by the horn by being the first state in Nigeria to actually embrace the power of technology. Not too many people are aware that Nigeria has an e-health policy, and that this e-health policy was drafted by a set of people set up by the federal government of Nigeria between 2013 and 2015. And this was because we were looking at the problem of universal health coverage. Because when you talk about universal health coverage, you're talking about, most people understand it to mean people that are living within the cosmopolitan cities. But then the people who need this care are the ones in the far to reach corners of the state. And that is not only akin to a state like Abia or in Nigeria. The world over, that is now what is being used to reach some of those far to reach areas. I remember as a clinician in faraway Glasgow in Scotland, we were able to sit in the comfort of one small consulting room with the video bit of it. We haven't even introduced the video bit of it. We're just at the audio bit of it, and with all the challenges that we are continuously surmounting. And you're able to treat people in faraway Shetlands. If you Google the map and see where Glasgow in Scotland is and see where Shetland Island is, then you can understand, And these days, people actually do guide people to do, surgeries from faraway countries like Australia. It is there. Now, what Abia has done is, after that draft was presented to the 58th National Council in Sokoto, I remember I was the second person that moved the motion for adopting that e-health policy. And then states were now mandated to go and then see how to begin to apply it. The idea being those places you cannot reach because of either terrain or because of, difficulties, whatever, then you're able to, using the power of technology. Today, all of us know that you can stay in the comfort of your home, pay your bills, transfer money, make all sorts of, financial movements that are within the law. And this same technology is being used to drive healthcare delivery services in other parts of the world. So Abia kicked in as the first state. Yes, obviously in partnership with our consultants, who, by the way, have actually started the thing, and they have a call center in Abuja. But Abia insisted on having its own call center. And this call center, which is located within the precincts of the government house, obviously for security reasons, is manned by medical doctors, trained medical doctors. I'm not talking about nurses. I'm not talking about medical lab scientists, by doctors. And you can go there and verify this for yourself. Now, there were initial challenges when that project was rolled out.
Okay.
Right. And part of the problem then was, telephone reach in those far to reach areas. And so today, we now have a partnership with Glo. And so what Glo did was to look at the nooks and crannies of Abia, where their services were poor, and then they've actually now made it a lot better. And so people are able to read. And don't forget, we are trying to use the power of telephony to drive healthcare, universal health coverage here. A state like Abia, with a population in excess of 4 million, has a telephone density of above 3.5 million. So literally everybody here has got a phone. And so what we're trying to do is to tap into that teledensity and then use it. And the service is very, very straightforward and simple. Following the prompts, you are able to...
How does it work?
That's what I'm trying to explain to you. Following the prompts, if you look at the card, and luckily I brought one of the cards that I'm going to share to all of us today.
Fantastic.
The instructions are very, very clear. By the time you scratch out this card, and that, don't forget, this card, when once you register it to yourself, it stays permanent. All you need to do, dial, there is a contact number there, and you dial it, and then somebody receives you at the other end of the line and asks you to enter your PIN number. And your PIN number is what you scratch out from here. Well, once you do that, it tells you this is how much you have. Would you want to be put through to a doctor? And you say yes, and straight on, you are put on to a doctor who obviously welcomes you and then asks you, certain questions, including taking your some of your biostatistics, your date of birth, your name, and all that. The idea is that the next time you call, he doesn't need to go through that prompt. When once your call comes in, all your data just comes up. And each time you have a communication with them, it is logged. So it's a build-up of...
they have an history of
exactly.
your health record.
Exactly. Exactly. And there are a few other things we're also going to do that will be interlinked with all this. In fact, one of the things that the Honorable Minister will be flagging us for us on Friday when he comes is the Abia Hospital Information Management System, where whichever part of Abia State that you are, it is one record that you have as a patient. All the doctor needs to do is just click on that button, and then where all your records come up.
So another thing we should be expecting this second term.
It's already ongoing.
In the pipeline.
We not in the pipeline. It went live 4 weeks ago, and that's the reason why the Honorable Minister, the second reason why the Honorable Minister will be here to flag it up for us.
I'm so much interested in this Dial a Doctor initiative.
Now I'm going back to it.
Okay, please do. Because
right.
This card, I'm seeing this card for the first time.
Yeah.
If I need this card, where can I get one? And is it more like a recharge card you get for your mobile phones? Because I can see 500 naira on the card here. Is it that I get a 500 naira before I can talk to a doctor each time I want to communicate with a doctor?
Well, let me answer it this way. This is actually the old card.
Okay.
In the new card, when once you access a card like this, you are in what we call the CUG group, which is a closed user group. Now, clearly, because of the arrangement we have with Glo, you no longer need to pay that amount. But then obviously, because you need to have one, because if you go to any of our primary healthcare centers, you don't need to pay to have that card.
Is it call-free?
Yes, it's call-free.
Okay.
Yes, it's cost-free.
Okay, cost-free.
Yes, it's cost-free.
Okay, now, I want to know how Abians are subscribing to this initiative.
Well, yes, like I said, following the launch and then the identified problems which we've been able to, continuously deal with, the next stage is now push out that information so that people begin to get aware, because we need the uptake to increase.
What is it like now?
The uptake is, probably about less than 40%, and that's because we're just starting. And that's also because of a few of the challenges that we've had. One of the challenges that we had immediately we started was power.
Oh.
Now, power has been addressed as an issue. At least we now have its own power generating unit, and in addition to solar backup. So that was that. And then the second one was the one I just talked about, the fact that in some far to reach areas, signals were very, very poor. And we had approached the service providers. I'm talking about the telephonic companies, and it was only Glo that agreed to work with Abia State. And so today we are working with Glo. And so clearly it's an ongoing process, and we hope that the uptake is going to increase as we go. Anything new, people are usually a little bit hesitant in accepting change. Funny enough, when we flagged off this project last year, and with what people in other parts of the world were seeing that people here were not seeing, we were invited to Rwanda, Kigali, and I remember going on that trip with His Excellency, the governor, and we went there to talk about how have you been able to apply the telehealth initiative. And then we went there and spoke about it. And today, they seem to have overtaken us in this same thing.
So it's about awareness?
Yes.
It's about, do I say education here?
It's a combination of everything.
But have you considered locating this thing in the communities? Like in the communities where you have somebody, we have a problem already in the primary health sector where you're sick, even the access road to the next PHC, it's a difficult thing. Why don't you have this within the reach of traditional rulers or community leaders?
Well, let me put it this way.
Or must it be so individualistic?
Well, let me put it this way. That's why I'm saying that, ignorance, of the larger public, which is what we're trying to address. Now, this facility is in all the 292 primary healthcare centers. And you will not believe it. Last week, when I went to one of the facilities to, where the minister is going to inspect, and I was looking at the telephone, because initially the telephones that were given to them were the handheld ones. And some of them were using it for some of the health practitioners in those primary health care centers. We are using it, for personal calls and all that. But then we now decided to place in each of those primary health care centers the tabletop, the regular telephone. And all these people are supposed to do is plug it and make sure that it is charged. And on that particular day, I went to this particular center. I won't call the names so I don't get exposed. And she was telling me that the thing is not working. It's been dead. And I said, how can it be dead? This thing is not charged. And all I did to get it back was to press the button, and then the light came on, and then we were able to receive calls. So you can imagine a situation where the health worker itself, is actually, not applying this technology very, very well. Then talk about the larger public. So it's quite, a work in progress. The idea is that we need to move these things out and then get people to understand that this thing is there, it is workable. We don't have to White Elephant project from our side. It is White Elephant project for those who are not aware that such exists, and they are working.
Okay, Honorable Commissioner, let's just move on now. Did you attend the last annual general meeting of the Nigerian Medical Association in Ebonyi State? Did you attend, or did you send any representative?
No, I wasn't in the country at the time, and then I think somebody attended on my behalf.
Or you're a member of NMA?
Yes, I am.
Okay, I'm sure you must have heard about one of the resolutions or one of the issues raised at that council, where they talked about Abia State, the health ministry that you supervise, owing workers about 13 months. Absolute, HMB, and other workers, different layers of the health sector. As a doctor, how do you feel about that?
Well, first of all, these are my colleagues, so I do sympathize with them. But then I think where I would actually stop is to tell you that the issues are being resolved. And so there's no need to prejudicate it by making unnecessary comments that will inflame emotions. But then that matter is being addressed and addressed properly. I know that just a few days ago we had a meeting with His Excellency the Deputy Governor, and it's an ongoing issue, and obviously, yes, that is being addressed. That's the only thing I would like to make as a comment here.
Okay, we appreciate that the thing is being addressed, and going forward, we hope that there will be a holistic approach to that. But then you talked about the personnel here, and I'm sure you would want to have maximum cooperation of the workforce to achieve whatever target you set for yourself.
Exactly.
So, what recommendation would you, assuming the governor asks you to drop the mantle today now as the Commissioner for Health, maybe move on to another ministry or given a higher task, what would you advise in terms of management of the workforce?
Well, first and foremost, I wish you were at the meeting we had with the Deputy Governor. Where I reiterated. I reiterated. You see, it's a balanced thing. There are problems from a release of funds to be able to deal with this, which obviously I am not Commissioner for Health, and I'm sure I'm Commissioner for Health, I'm not Commissioner for Finance. I'm sure the Commissioner for Finance, who's been here severally, has been talking, on what to do. Clearly, there's also problems from our own colleagues. I remember at that meeting, which is the reason why I'm saying I wish you were there, I had challenged them. And I said to them, you are also part of the problem, sabotaging the system that you're supposed to be, helping to grow. How come it is that, most consultants in these facilities have, touts who are, busy giving cards, directing patients away to their private centers? Is it not the same patients that are supposed to be used to generate the part of the IGR for running the place? I have had a person ask commissioner for health, I've had a personal experience of, the one celebrated case that was making the rounds in the social media. I had to trace that particular patient to the hospital in Abia. And incidentally, it was one of the consultants. And when I got there, I said, is this not the same kind of patient that we used to teach you and I? If a problem arises on account of the complications from this patient's problem, are you able to deal with it? Because what will kill him is not even the illness. The fact that the guy's throat was being, choked. If that happens, you have facilities for doing a tracheostomy, which is like opening the windpipe so that at least he can breathe. And she was looking at me and then, very, 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 very morose. But then the only reason that we didn't well the big stick is that was a duly registered health facility. So I'm talking about people in the system sabotaging the system that they are supposed to be part of, and the reason they are giving is that they're not being paid. Now look at it this way: you say you're not being paid, at the same time you're taking away what is supposed to help in generating. And do not forget, these are parastatals, and when you say label it parastatal, it means it needs to generate income. And nobody is asking them to pay to the government what they generate. It is, let us generate and then use it as,
the fund.
Yes, to try helping in the funding. What government owes them is subvention. So what we should be talking about here is regular payment of those subventions. And that is what government is trying to address, because part of the subvention they use in paying their wages and emoluments. But then clearly I'm saying that the responsibility is on both sides. Government will do its own part, but we also expect our colleagues out there to do their own part.
Dr. John, let's take a look at the primary health centers and, of course, the general hospitals across the different nooks and crannies of Abia State. These facilities, are they functioning?
Well, let me answer that question this way. I had said at the beginning that our impact has been across the board.
Okay.
Primary, secondary, tertiary, but mainly on the primary sector, because that is where the larger part of the population.
Those the health centers we have across
and
the
so
state.
I know on our own, using funds that we attracted from the Saving 1 Million Lives, we've been able to equip those primary health care centers. I don't know if you remember sometime in August last year when we called all of them, all the people running all those centers to Umuahia here, specifically the headquarters of Umuahia North Local Government. And we distributed equipment because we had done, an across-the-board assessment. What is it that they need? What is it that they are lacking? And we had used part of the fund from the Saving 1 Million Lives to purchase those, and we actually distributed those things. The deputy governor was there.
Okay.
Now, as if that is not enough, now we are getting funds again from the Basic Healthcare Provision Fund. Part of that fund, I had told you, is going to be applied in providing staff, providing equipment, providing drugs, providing other infrastructure. I do intend that these facilities, these 292 facilities are going to have all the year-round water and all the year-round light. And my emphasis will be not on generators, it will be on renewable energy. That is the way to go, and that's where we're going to.
Okay, it cannot be all rosy. There were high points, and definitely there were low points. I don't know if you want to reveal the low points. It cannot be all good and good and good and good.
Well, I mean, the low points are very, very clear. If you don't have money, then you wear your thinking cap. So largely, we've not had all the resources that are supposed to be made available to us. And so that obviously has led us to thinking outside the box to bring out some of these things that we can use and then be able to still achieve our aim of universal health coverage. You didn't give me the latitude to give you the other things. We've just been talking about telehealth, and there are 1,001 things that I need to talk about here today.
Just spotlight some of them.
Okay, right. Using the power of technology too, we've been able to get what they call the E-Remind Me project. Now, that E-Remind Me project is targeted at pregnant mothers and then children under 5 years of age. And clearly, it's a USSD service. It does not cost you anything. It is a service that is free of charge. And the USSD number is *347#.
Well, it's about technology now.
Yes.
The first one, telehealth initiative. Second one, dial a doctor. Now this is something.
I told you we decided to wear our thinking cap. And that is where some of these things are coming out from. Now, that project, straightforward. For the pregnant mother, what it does for you, and once you sign onto that service, because again, we're also using the fact that the teledensity in Abia State is very, very high.
Okay.
So once you sign onto it, there are options it gives you. For you as a pregnant mother, it asks you your last menstrual period, because that's when we now start counting for you. And automatically, once you give that, it automatically calculates for you the number of antenatal care services that you're supposed to, assess. I think usually there are 4. I'm not an obstetrician and gynecologist, but I think it's about 4. And 2 days, 1 day to that day, you're supposed to go. An automatic message is generated for you that your antenatal care is tomorrow.
These brilliant initiatives, how accessible has it been to those in the rural community? Some of them do not even know how to operate these phones they're making use of. They get to call somebody, the neighbor, the next door person, please help operate this phone.
Well, that is the reason why we have 17 local government areas, we have 17 health authority secretaries, and we have other foot soldiers who are supposed to cascade this information, in addition to things like what I'm doing now. And for people who are listening, and education, flyers, we're even reaching out to churches and then trying to push this information down. But then I think in this part of the world, people are not, they're not in a terrible hurry to make changes, which are very, very simple. Like this one I've just told you now. So you can see that, clearly what you want a pregnant woman to do, because pregnancy is a physiological process. It's not punishment. So the idea of attending antenatal is to be able to identify problems and being able to deal with them before the woman is about to deliver. Now, for the under 5 child, once that child is registered, it automatically, because it will ask date of birth of that child, it automatically calculates the days that this child is supposed to be immunized, to have your complete immunization. And a day or 2 to that day, you also get a text message telling you your immunization is so and so. It even goes further to tell you that this immunization that your child is due today is not available in Nkata Primary Health Care Center, where you normally attend. It is available in the World Bank Health Center. And that is because the information is being updated on a regular basis. And that is for the what do you call it, the E-Remind Me project. There are a few other things we've also done. I'm sure you know that our Abia Hospital, which was shut down for more than 7 years, we've reopened it. And our Abia Hospital is one of the key centers we are using for this pilot for the Abia Health Information Management System, where every patient in Abia, it is one record, whether you're in Arochukwu, whether you're in Owaza, or whether you're in Umuahia. And so it makes it a lot easier for the doctors to manage you, because they're looking at your records, whether the records were acquired in Aba. He's able to see your last consultation, your results, your radiology results, including the x-rays. They will be posted on that system.
You're moving from analog to digital.
But that's the way to go, my brother.
How do you tend to impute the records, for example, records of over years now, to make it digital?
No, we're not. What we're doing is we just
start from the present.
Yeah, just start from the time, and so build up this record.
Okay.
Because it's going to be quite difficult to go back, and because some of the files are actually missing.
Okay, Commissioner, I want to find out something. The relationship between your ministry, the state government, and some of the partner health agencies, has the government been up to date with some of their own obligations? Because we understood that I think DFID has moved. They used to have a zonal office here. Some other health partners.
Well, you remember when I started,
Yes.
I said that the first question I was asked at the House of Assembly is, what do I think was responsible for them moving?
Exactly.
And then what are we going to do to bring them back? My brother, what we have been doing to bring them back is confidence building. If we agree that this is what, because the funding pattern has now changed. It's no longer where they used to pay money into a state government account and then you start using anyhow you like. No, they hold back their money, and in fact keep it in the central bank where it is beyond your reach.
So can you confirm some of the assistance in funds and inputs that you have received so far since 2015, Honorable Commissioner?
Well, if you read my lips very, very right, they no longer give you that physical cash.
Okay, so they give you...
yes, what they do. Let me tell you the way it works now.
Okay, sir.
First of all, you have to come up with an idea. It's no longer, them staying in Washington, D.C. and making up their mind what you need. No, you need to come up with an idea. I'll give you a very simple example. When we were cutting the Bill and Melinda Gates Foundation, after we successfully hosted the 59th National Council, we sent in our first proposal. They considered it inadequate, and they indeed sent us to their university, what they call the Challenge Initiative University. So we were here attending a virtual university to be able to now write what was acceptable.
But you're
to
a
them.
beneficiary of the Challenge Initiative.
That's what I'm saying. Then
Okay,
I'm building up a story.
Okay, sir.
Right. So it was only when we finished attending that university and now wrote our proposal that it was now accepted and then passed. They are key players in the area of family planning, and so when they now accepted to, the next stage, like every other funding agency that's coming to assist you, you now need to do a work plan. That work plan has to be in tandem with them. So once that work plan is planned with them, the next thing is costing of that work plan. And the costing of the work plan, you have to put a price on each aspect of that work plan. And so when you start executing, it will be, okay, so what are we going to do for this quarter? And you point it out.
Okay.
And once you agree, how much was agreed for that project, and it is there, and they release that to you. And indeed, maximum 1 month after they release the fund, they are here to eyeball what you have used the fund for. So what I'm trying to say here in essence is that they do not give you the money. Others, like the Qatar Foundation too, that we've been able to bring back, gives things like drugs, and then motorized equipment, because for the 17 local government focal persons for the non-communicable diseases, especially filariasis and schistosomiasis, they were able to give 17 brand new Honda motorbikes. And wait until you hear this. When they came to distribute this motorbike, they did not keep it in the States. There was a training meeting, where the focal persons came for training here in Omai, somewhere here in Omai. And on the day of that meeting, they brought those equipment, because according to them, in the past, they had done a similar thing, and all those motorcycles disappeared. And so those motorcycles were handed over just as the meeting was ending to the people who were going to use it.
All right, let's head straight to the phone lines. A lot has been said. We'll go to the phone lines now. When we return, we want to see the way forward. But what do we expect after this first administration in the health sector? What do we expect in, of course, a certain agenda? 0808-182-6949. 0811-605-2949. 0808-182-6949. 0811-605-2949. You can also drop your messages on the SMS line 0906-510-8289. It is the impact. So we're looking at the Pazu's administration in the health sector, the first term, and of course, we're also doing an agenda setting. We're looking at what we should expect as it concerns the second term tenure of the governor. They will be sworn in on the 29th of May 2019. Hello, good afternoon to you.
Hello, good afternoon, sir.
Good afternoon to you.
Commissioner, good afternoon, sir.
Good afternoon, my brother. How are you?
I'm fine, sir. I'm Okoji Prince. I'm calling from Umaya.
Okay.
I like this program very well. What I just wanted to ask is, I take more interest on the aspect of telehealth system. What I want to know is the personnel involved, are they really reaching all that is reaching the villages? As in, are they at a kind of alert that whenever you call, irrespective of wherever you call, you are calling from, are they really at alert to attend to the call? That is one.
Okay.
And the second one too is, I believe that healthcare is somehow it's a teamwork. But at times, whenever you You keep mentioning doctors. I mean, is it that the other healthcare professionals, like the nurses and maybe the pharmacists, they don't have any role to play as far as this initiative is concerned, the telehealth something? Yeah.
Okay,
So
thank you for your contribution. Let's take more calls. 0808 182 6949, 0811 605 2949. Not forget the SMS line 0906 510 8289. Okay, hello, good afternoon to you.
Hello.
Yes, good afternoon.
Yeah, good afternoon, Michael.
Yes, good afternoon to you.
Good afternoon, Honorable Commissioner.
Good afternoon, my brother. How are you?
Yeah, I'm calling you from Bender.
You're
Okay.
welcome.
Yeah, I must commend the governor Ukeje Igbazu, because one area he has done so well, apart from the area of small and medium scale enterprise, is the health. You know, because they say health is wealth. The governor has done well, apart from the tele initiative. Some time ago, about 1 or 2 weeks ago, there were these a project they call a makeover of 72 hours or thereabout, where the maternity homes were renovated. I think Bender here, we benefited from it. And again, the governor has been up and in paying a counterpart fund in attracting other foreign donors and the rest of them. And again, there is this a basic health fund which is about to be launched or thereabout, where Abians will benefit. I think they are really doing well in the area of health, and we are not surprised that the Commissioner for Health was equally returned. I think that is a true evidence that he has done well.
All right.
Have a nice day,
Thank you very much. Hello, good afternoon to you. Hello. Hello, good afternoon. Okay, we lost that. You want to respond to some of those things said over the phone?
Yes.
Okay.
I think for Frank, who was the first caller, you know, he was talking about all hands being on deck, you know, if people are allowed to calls and all that. Let me tell you, Frank, I think what we require here, one, are the telephones, which can be moved to any part of wherever you stay. And then, of course, those who are receiving the calls. Those who are receiving the calls are here 24 hours. It might interest you to know that in the call center, which maybe for security reasons I probably might not ask you to go in a group, but then you can come individually. It's there in Government House. And we have provided for these doctors, for those of them that are on call, a very comfortable accommodation right in that center there. And it has that place even has a kitchen. Food is provided for them, and you know, a comfortable resting place. And they take turns. You know, it's like being on call. You're on call for a period of time, and then the next person takes over. And at any point in time, there are 10 doctors. What we discovered was because the call levels were low initially, you know, those doctors were being underutilized. But now that the call volume is now beginning to gradually inch up because of the efforts we are making to push out
To sensitize.
the information.
Okay.
You know, so clearly what I'm saying here is that we're not, in the case of you know, people being allowed to calls and all that, it does not arise, because what you need is your telephone, and then the people at the other end, the doctors at the other end, who are to receive your calls. You have talked about, are there no roles by pharmacists, lab technicians? Of course there are roles, because obviously for want of time, the question would have been, so what are the outcomes from these calls? Now, one outcome is that, yes, you call, and then the doctor listens to you and says, okay, fine. From what you have described, we don't think that this is anything serious, and so you don't need to do anything. That is one outcome. The second outcome is that from what you have just said, described, Mr. John, I think what you've described is such that we can't deal with it over the phone, and you need to upscale to the next facility.
We have to make
and then,
it very snappy.
Right, and then the next outcome is that, right, what you've described looks like a simple, straightforward malaria. I am going to send you a prescription, and that prescription is sent as a text message to that phone you're using to make that call. And then, of course, you're taking it to a pharmacy shop, and then you know, showing it to them, and then they can now, you know, serve you your prescription. The idea is that we want to obviate the need for people to just walk into a pharmacy shop and say, make some medications for me.
Okay, but before we go on the way forward, I would like you to state that in less than a minute because of our time. But then, the accessibility of this card, I'm still very much interested in that.
So where can we
get the card?
Right. For now, we intend that in the shortest possible time. These are actually funding issues. In the shortest possible time, we have kiosks that are now being modeled. If you know, during the during the electioneering period, we decided to have mobile umbrellas for those but the idea is to have kiosks, and then these cards are going to shortly be sold in the in the supermarkets. But if you go to your primary health care center, you do not need this card.
Okay, well, thank you very, very much, Honorable Commissioner for Health, Abia State, Dr. Jonah Hukan. We really do appreciate your time on the program this afternoon, the impact, and we focused on your ministry, the Ministry of Health. It's been an engaging conversation with you.
Thank you very much.
Well, thank you very much, my interviewers, and then thank you very much for your patience, our listeners. There were quite a lot I was supposed to tell you, but then this gentleman here would always push me out of talking you through some of those things. But be rest assured that there's quite a lot that's been achieved in this administration.
Permit me to take this message just before we wrap up the program. Doctor, may God bless you. Until all these private hospitals and schools are stopped, people will continue to suffer and die at government hospitals. Doctors always redirect patients to their private hospitals and cut off their head with bills. Thanks, Chidi. All right, thank you very much for being part of the program. The impact on Flow 94.9 FM.
Well, that's how we wrap the show. Join us on Monday for another.
When we take a look at another sector. Yes. My name is Michael Oni.
Radio.
It's not just radio anymore. Flow 94.9 FM brings you something big and new. Let's give you that camera lights action effect, which is also part of our complete outside broadcast services for all your event coverage, both recorded and live. Juicy offers await you as you do business with us.
Let's go.
So what do you have? Is it a wedding, cultural event, birthday, conference, seminar, or showbiz? Whatever it is, we are always ready and set to give you what you need. We also run visual advert for your company, products, and services. And we air not just on radio, but also on our online TV. For more information and booking, you can visit Flow 94.9 FM located at 7B Factory Road, Umuahia, or visit our marketing office at Bank of Industry Building, number 1 Constitution Crescent, Asa Road, Aba, Abia State. Or call our marketing team on 0703-160-8029 or 0805-174-5686. Flow 94.9 FM, the flow of God's own state.